lot about sleep, from the rules that we set for the little ones in our lives, like go to bed and wake up at the same time every day, don't consume caffeine before bedtime, and get lots of exercise.
That's right, but as adults, not being able to sleep can be a really big problem, especially when you have to get up early for work.
Yeah, so we have Dr. Leisha Cuddihy, a sleep psychologist with Spectrum Health Medical Group, here to talk about some ideas about dealing with insomnia. I think sleep is like the most underrated thing out there.
I think it is. I think a lot of people have sleep problems and they kind of just say, well, I've learned to deal with it, or
right.
I don't want to take sleep medication, so I'll just suck it up.
It affects so many other things in life.
Yes, it does. It does. It's very commonly seen in people with other medical and mental health disorders.
Okay, so someone that isn't getting the proper sleep that they need, you never know if it's just you've been drinking caffeine or if this is something that's been going on for a longer time. What is a sleep psychologist?
So a sleep psychologist is somebody that provides treatment for sleep disorders without using medication. So a lot of times when people have chronic problems, like you were saying, getting to sleep, they get into bad habits around their sleep. And what a sleep psychologist does is really kind of individually focus on what bad habits they have and trying to change them. So in a way that's better for your sleep.
When does the person know when the right time is to come and see someone like yourself? Because I think off and on throughout life, we all battle this.
Right. So, I mean, everybody, it's completely normal to have intermittent periods where you're not sleeping well. But if you have a problem sleeping at least 3 nights a week for more than a month in a row, then it might be time. Or if you notice that your sleep is really starting to interfere with your life, and especially if you are taking a sleep medication that's not working, or if you would rather not take a sleep medication, but your sleep is really bothering you, those kinds of things.
Okay, so what are some of the things that we can watch out for to not do before it's time to go to bed?
Well, first of all, going to bed at variable times. Like if you have a bad night, you generally don't want to go to bed too much earlier the next night. You can't really make up for sleep that way, and it ends up creating a bad habit where you're trying to get more and more sleep but not really able to. Like you already talked about, avoiding caffeine within 8 hours of bed, actually.
Within 8
Wow.
hours?
Yeah.
That's incredible.
It stays
I
in
would
your
have
system.
said 1, 2, or 3, maybe, but 8. Wow.
Well, yeah, generally early afternoon is kind of the last time you want to have your caffeine. Also, nicotine and alcohol interfere with your sleep, so if you can have your last cigarette, if you're smoking, a couple hours before bed, and avoid alcohol close to bedtime. Napping during the day can also interfere with your nighttime sleep. So you can think of it as kind of your body works like a battery. If you charge the battery earlier in the day, it's not going to charge at night. And regular exercise also helps you get better consolidated sleep.
So what are some of the options? You know, you talked about medications. We know that a lot of people don't like to take medications. We've heard things about sleep studies and different types of things you can do to learn more about when you're sleeping and what problems you're having. What is the range for people and how you might help somebody?
Oh, well, it ranges from anything, like we were just talking about, like the insomnia treatments. You generally don't need a sleep study for that, because you go in the sleep study and all we see is that you don't sleep, and so that's not entirely helpful. But ranges all the way to people who have sleep apnea, who would probably need to consult with a sleep physician and get a sleep study to rule that in, but they often get prescribed a CPAP, which is a mask that you wear over your face, and it can be very challenging for some people to wear that all night because it's a new thing and it feels kind of weird, and some people have anxiety about it. So that's another thing I help people with, is getting used to that machine and really being able to treat the sleep apnea well.
You know, everyone has had trouble from time to time getting to sleep or staying to sleep, but for someone who has been seeing this as something that's been going on for night after night after night, months, years, what is their first step to finding a cure?
Well, I mean, the first step could be a consultation with a specialist. Sometimes it's the rules that we're talking about today and the rules that you hear are sometimes enough to help, but I'm not going to give away all of my secrets today. So.
Don't do that.
It is, the program that I have for treatment is very kind of rigorous, and it's easier to do with the help of somebody else.
Yeah. What would you say would be the most common problem among people that come to see you? What are they dealing with in their lives? You know, is it stress? Is it that they're eating the wrong things?
Oh, I would say stress is probably the most common cause of difficulty sleeping, and mind racing at night, and anxiety type stuff. But I see people who have medical problems that are interfering, chronic pain, other forms of anxiety and depression. So it's really a wide range of people that have insomnia.
You brought up the mind racing. And I think that when you're busy, that happens a lot. How do you get around that? Because I've heard different thoughts and theories about why that happens, and you know, is it possible to just, you know, clear your head and try to go back to sleep? Because I find that people get more stressed out because they're not sleeping, and that's a barrier too.
Yeah, and that's the ironic thing. Like, you worry so much about trying to get to sleep that you don't sleep. But there's really no way to clear your mind. The recommendation would be, like, don't spend a lot of time in bed worrying, because then you set your bed up to be a place where you're worrying instead of a place where you're sleeping. And when a lot of people worry at night because they're so busy, like you said, during the day. They're not really necessarily processing all of that, and then you get home and you go to bed and your mind isn't occupied by anything else, so then the wheels start turning. So a good thing to do is to set aside some other time to, like, think about all the stuff you have to do the next day, or things you didn't do today, or whatever. And then when your thoughts go there, just kind of redirect. Focus on breathing. I mean, it's really hard to control thoughts at any time of the day, so the best you can do is kind of focus them intentionally somewhere else.
Okay, that's one of the things that I have noticed with my sleep problems is just, you know, the mind racing. But growing up, you hear your parents say, don't watch TV before you go to sleep. You won't be able to go to sleep. You won't be able to relax. Is there any truth to that?
For some people, yeah, and it does depend on what you're watching at night. Like, you probably don't want to, all the crime dramas are on right before everybody gets to bed, but for some people that really does affect them and make it harder for them to go to sleep. I don't think that in general TV is a bad thing for sleep. I mean, if your kids, if you want to limit them watching TV in general, maybe not, but I don't think that it has a big impact on your sleep unless you're watching things that you start thinking about later.
Okay. Well, thank you, Dr. Cuddihy, for your insights. I know that there are people that are probably watching, they're interested, and you could probably give extended advice too. So here is the information. You're located on Lake Drive, and there's the phone number, website. Thanks for coming in and sharing your expertise.
You're welcome.
Thank you so much. Don't go away. We'll be right back.